Virtual reality has become increasingly popular over the last few years, and because of that, many new forms of entertainment were created. Things like video games to 3D art. It gives people a brand new feeling to the things we have now, but in a new, more immersive way that people have never experienced before. One thing that VR brought alongside the digital entertainment is the use of VR in healthcare. And so with that in mind, here are 5 ways VR is used in the medical world. Number 5. Exposure therapy. Treating people by gradually exposing their phobias and anxiety. Through different types of stimulus, this allows people to learn and manage their anxiety. Similar to regular exposure therapy, but with VR, this puts people in a controlled environment with less costs and risks. You can put a virtual spider or have someone high up top of a building over and over again until they're comfortable with it. And it doesn't just have to be phobias. Some psychologists have already used this technology to help soldiers recover from PTSD by exposing them to simulated combat situations. Number 4. Surgical training. Medical VR doesn't just stop at helping mental patients, but also physical medicine. By using VR to stream a live surgery, relatives can watch the surgery go through, as well as pre-recorded surgeries for future surgeons so they can learn and experience it themselves. There are also brain simulations used as a way to help surgeons look inside it and understand their patient's brain before they operate on them. Number 3. Dentistry. Similar to surgical training, VR can be used as a way to help trainees physically learn and work on their patient's set of teeth by simulations. By doing so, it will lower the cost and help new dentists learn and practice working with teeth in simulations, speeding up the learning progress. Number 2. Phantom limbs. Phantom limbs are just like any other limbs that you would feel, except it isn't actually there. Your brain has active neurons that become inactive when you lose a limb, but your brain still perceives that missing limb, and can cause a weird feeling or even pain. By playing virtual reality games that get patients to complete simple tasks like picking up objects and dropping them, it not only gives them a visual representation of their limb, but also physical control over them by attaching electrodes to the base of the missing limb, allowing them to feel and see as though they weren't missing a limb at all. And number 1, relaxation. Being stuck in a hospital is never fun, and you may not even be able to leave the bed. VR can help patients release stress and reduce pain. They could escape the walls that bound the patient and leave the hospital to visit a place on Earth, watch a sports game, as if they were actually there. VR can not only improve the hospital's experience, but also the cost of caring for the patients may be reduced, reducing stress and pain. The length at which the patient stays in the ward or the amount of resources utilized could be decreased. Virtual reality is definitely starting to show its value, and not just for entertainment, but also to help other people. VR has become more popular these past few years, and as time goes on, I'm sure we'll see even more innovative ways to use this technology for the better.